And welcome to Chapter 37, Impact of Cognitive and Sensory Impairment on the Child and Family. Cognitive impairment is the term that has replaced mentally retarded, so we no longer say that, and it applies to any type of mental disability or deficiency. By definition, a disability is defined as an IQ of 75 and below. In addition, the child in question must display impairment in 2 of the 10 adaptive skills areas. Those are listed for you up on your slide. Those include communication, home living, community use, leisure, health and safety, self-care, social skills, academics, work, and self-direction. So again, cognitive impairment or mental disability, IQ of 75 or less, and then impairment of 2 of those 10 adaptive skills areas. Just for reference range, the quote normal IQ is between 90 to 110. The results of standardized tests are used in making a diagnosis of cognitive impairment. Diagnosis of mildly impaired characterizes 85% of the population with cognitive impairment. So what I basically just told you is that most people who have a cognitive impairment are diagnosed with a mild. 85% of those with cognitive impairment are classified as mild. Generally, people with mild impairment can still read. They can do some math up to like maybe a 3rd or 6th grade level. They are usually employable. They get married. They may struggle, however, with raising a family. Moderate impairment affects about 10% of those with cognitive impairment. They achieve mental age of a 3 to 7-year-old. These children usually cannot ever live alone or care for themselves. So what causes cognitive impairment? Maternal infections, or infections that happen like in utero, of rubella, syphilis, maternal drug ingestion, chronic lead ingestion, and kernicterus. Who remembers what kernicterus is? We talked about it in the newborn unit, but it's caused from high bilirubin levels that end up causing permanent brain damage. Trauma can also occur while the baby is still in utero. I told you guys before, I have seen babies born who have had a stroke in utero. Or there can be brain damage after they're born, including shaken baby syndrome. A hypoxic event during labor can also cause brain damage to the baby. Remember when we talked about rhythm strips? What strips or what patterns do we like? What patterns do we not like? Phenylketonuria or congenital hypothyroidism are the most common metabolic and endocrine causes of cognitive impairment. Microcephaly and hydrocephalus, genetic mutations such as Downs or Fragile X, prematurity, low birth weight. Sometimes it includes children who are on the autism spectrum, not always. And there can be environmental influences as well. I have a clip on your slide from the movie I Am Sam. How many of you guys have seen that? It's a movie about a cognitively impaired father who is raising a child who is not cognitively impaired. It's a really touching clip, and it just shows you what some of the challenges are for cognitive impaired parents. These are some of the reasons why they struggle in raising a family. If you haven't seen the movie, it's a really great movie. If you're an emotional person, it may tug on your heartstrings a little bit. Tears have been known to leak out of my eyes, but then again, that's not an uncommon occurrence either. But watch the clip, please. Okay, so what are your nursing interventions in caring for children who have impaired cognitive function? These children are going to need PT, they're going to need OT, they may need first steps, they may need referrals to Head Start. The earlier you get them help, the better the outcome will be. Therapists will assess what areas are deficient and they will work on those skills. I have a close friend and her daughter has autism. When this little girl was getting close to kindergarten, she couldn't even put her own clothes on and she was not potty trained. Her parents had an intensive therapist who came to their house. It was through a company called Judavine, I believe. Came to their house for 14 hours out of the day for 2 weeks. And by the end of it, this little girl was getting herself dressed, she was potty trained, and she was so much more independent in her self-care skills. And it wasn't just training with the little girl, they did training with the entire family. How do you help this child? How do we fix this? as much as possible. So here are some more nursing interventions for you. Communication is always a tricky thing. Sometimes these children need to communicate through picture boards or computers and sign language. Sometimes they communicate through bliss symbols. But you got to figure out how to communicate with them in order to communicate. So you're going to have to adapt yourself to meet where they are. Establishing discipline is important because these children may lack the ability to self-correct their behavior because of their impairment. Socialization is still important. It can be done through the preschool and school settings, and it's good for these children to be around other people and other kids their own age. Sexuality is a tough one. Adolescents still need the education, but it may need to be simplified. They may not need quite as many details, just some basic rules of you're allowed to do this, you're not allowed to do that. Contraception is very important again, because a cognitively impaired adolescent with hormones raging may not be able to comprehend and fully understand the ramifications of their sexual behavior, including acquiring STDs or pregnancy. Parents are always concerned about what will happen to the child when they can no longer care for them. Sometimes a sibling will assume care, and sometimes these children will have to go and live in a group home. While they are still children, hospitalization is always a stressful time, like it is for anyone. It's important as the nurse to keep explanations of procedures simple and to the point. Focus on growth-promoting experiences for the child. Children who are cognitively impaired do not need every single detail of what is going to happen when you draw blood. Simplify it. Keep it simple. And that actually would work for about any child in the hospital. As far as assist with measures to prevent future cognitive impairment, counseling and education regarding nutrition and tobacco use. If the cognitive impairment was due to some sort of environmental thing, teaching people about awareness and the danger of certain chemicals. Also a prenatal exposure to alcohol, make sure expecting moms know to avoid that. It will also help if they check expectant moms. That's what, I think they generally do check everybody to make sure that moms are immune to rubella. There may be some genetic counseling that will occur, and then maybe some folic acid supplementation. All right, Down syndrome, also called trisomy 21, it is the most common chromosomal abnormality. The cause is unknown. It's probably due to multiple causes, honestly. It does occur in all populations and in all races. Generally, we say that the older the mother is, the higher the risk. And once a mom crosses age 40, the risk shoots up to about 1 per 100 births. So you guys have all seen pictures of, or maybe you know somebody who has Down syndrome. Most of the time, children with Down syndrome have a very characteristic look to them. Low set ears, flat occiput, semi-increases across their hand. That's when you look at the palm of their hand if they have a line that goes just straight across. Most of us have lines that are curved. Even if you have a semi-increase, it's not diagnostic of Downs, it's just a characteristic, but it doesn't mean you have it. And you guys are all staring at your hands right now, I know. A flat nasal bridge, kind of a protruding tongue. Sometimes children with Down syndrome have some low tone. It is diagnosed with chromosomal studies, so they'll take blood. It can be suspected but not confirmed via ultrasound prenatally. And you can read about some of the physical problems, but leukemia is definitely one. It doesn't usually happen right away. It usually happens like in toddlerhood or at some point during childhood. The other thing I want to make sure you guys understand is Down syndrome kind of occurs on a spectrum, so it depends on when the trisomy error occurred. If the trisomy error occurred early in the pregnancy, then all the cells were replicated using the trisomy 21, using the altered cell. But if the trisomy occurred later in the pregnancy, if the error occurred later, then some of the cells are going to be normal, and then there'll be less cells that are going to be copied and duplicated. So that's why there's a spectrum. It's kind of like this. If you are making a house and there is a crack in the foundation, because that, when you pour the foundation, that's early in the house building process, then the whole house is going to be affected from that one crack. However, if you are building a house and the foundation's fine and the framing's fine and the plumbing's fine and everything else is fine, but you get one little crack somewhere else, then it may be there, but it's not going to be as noticeable. It may not affect the overall structure of the house. Does that make sense? I hope so. Management of problems for children with Down syndrome. The hypotonia can cause compromise in respiratory expansion. Sometimes these children have a constant stuffy nose because of the slightly flattened nose. They may have chronic or frequent respiratory infections as well. Sometimes they have feeding difficulties learning how to eat because of the protruding tongue. Sometimes children may need a G-tube until they are older. The prenatal diagnosis comes from a triple screen / AFP. That's a prenatal screening test. That's really important to be accurate on dates, because if you're not accurate on your dates, you can get a false positive. If it is abnormal, then that can be followed up with an amniocentesis. Fragile X syndrome is the second most common genetic cause of cognitive impairment after Down syndrome. It is caused by an abnormal gene on the lower end of the long arm of the X chromosome. It is more common in men than in women. Why? Because women have an extra X to mask the damaged one. Men don't. So it is considered to be an X-linked recessive. If females will be carriers, and they can be, quote, normal, males will not be carriers. They will always be affected. There is no cure for Fragile X syndrome, so management of symptoms is the best bet. Tegretol and Prozac can be used to help control temper outbursts, and CNS stimulants can be used to improve attention span. The same meds that we use to treat ADD and ADHD. Again, with everything, the earlier the therapy begins, the better. Hearing impairment affects between 1 and 6 per 1,000 healthy full-term babies, and between 2 to 4 per 100 premature babies. So obviously a lot more common in preemie babies than full-term babies. The hearing impairment can range from slight to moderate to severe, in which a hearing aid can be used. Severe to profound hearing loss usually means that they cannot process linguistic information. As far as causes, ototoxic drugs, we always think of classic gentamicin, which is why you draw peaks and troughs when you're in the hospital. O2 administration, again, we are really picky about administering O2 to preemie babies for that very reason. A, because we're concerned about retinopathy, and B, we are concerned about the potential damage to hearing. It's not the oxygen that causes the damage, it's the mechanism of delivery. Vents can be very loud on baby ears. Just FYI. And then you can read through the rest of the causes there on your slide. Conductive hearing loss is the most common and often the result of recurrent otitis media. It involves interference with the loudness of sounds. Sensory neural hearing loss is the most common cause of it are your congenital defects of the inner ear structures, or from kernicterus, or from ototoxic meds and exposure to excessive noise. You can also have mixed hearing impairment, and if it's both, then you have interference of sound and the neural pathway. All right, so what are we going to do if a child has hearing loss? Cochlear implants work only for sensory neural hearing loss. Hearing aids only work for conductive hearing loss. So that kind of tells you which one we have. Remember, if it's conductive hearing loss, that can be caused by chronic ear infections. So put tubes in those ears, give antibiotics if indicated, but you got to clear up the ear infection. Oftentimes the ear ear or the hearing loss will improve once the infections stop. Additional aids, you can add the flashing light feature on your cell phones so that they flash when when somebody gets a ring or a text. There's also closed captioning. Socialization, these children need to help. They may need help to participate, but they're still just kids and they still just want to play and have fun with their friends. So you may have to kind of help them out a little bit, especially like in the hospital setting. They may need help in the playroom. You may have to explain to the other children why this child, if they are talking, why they don't sound like, the other kids, or if they're not saying much, why they're not saying much. Support the family. Make sure you can connect them with community resources. As far as supporting the child in the hospital, reassess understanding of instructions given. Make sure that they understand what they're supposed to be doing. You can supplement with visual and tactile media, provide communication devices, picture boards with common words, and then of course you have the child life specialists, and they may have additional aids as well. So now let's talk about visual impairment. This is a very common problem, especially during childhood. In the United States, the prevalence of blindness or serious visual impairment is about between 30 to 64 per 100,000 births. It affects 5 to 10% of all preschoolers, and it can be identified through vision screening programs. The causes are listed for you on your slides, but postnatal infections include rubella, measles, chickenpox, glaucoma, cataracts, fetal alcohol syndrome, herpes, toxoplasmosis, Down syndrome, and retinoblastoma. With partial impairment, children don't usually need large print because it's the distance vision that's usually affected. The near vision is usually better. And you should know the definition of legally blind determines the eligibility for tax status, special schools, financial aid, and other benefits. Refractive impairment is the most common. When light enters the eye, it should bend and land on the retina. If it lands in front of the retina, it's myopia, or you're nearsighted, which means you can't see things far away. Or if it lands beyond the retina, it's hyperopia, which means you are farsighted and you can't see things close up. So in your nursing assessment, you want to look for babies who don't track or follow objects, babies who don't make eye contact, or have a very dull or vacant stare, when babies don't imitate facial expressions. Those are clues that there is a visual impairment issue going on. In toddlers and older kids, look for blinking frequently, bumping into things, which I rarely see kids do, squinting a lot, holding objects really close, pushing their head forward, rubbing, shutting, or covering their eyes. So in caring for a child who's visually impaired while you're in the hospital, make sure you encourage the use of all senses. Promote socialization. It's important for them, for these children to be able to go to the playroom and have interaction with other kids if that's medically appropriate. Encourage physical contact. Make sure you call out the child's name when entering or leaving the room. Describe all procedures before they are done. Describe foods and the locations on the tray. Give these children age-appropriate tasks. Discipline and rewards should be the same as they would for other children. And encourage contact with other kids as the child grows older. So these pictures just show a couple of children who have the retinoblastoma, which is a common malignant intraocular tumor in children. Signs and symptoms include that whitish glow around the pupil. It's called the white reflex, and you can see it in both of these pictures. Treatment is chemo, radiation, and sometimes they just take out the cancerous eye and replace with a prosthesis. So now let's talk about the autism spectrum disorders. I really hesitate, and I hate that your book throws autism in with the cognitive impairment, because I know a lot of children who have autism who are brilliant. They are extremely intelligent. So I don't know that it's so much of a cognitive impairment, but it is an impairment to children nonetheless. So maybe that's why your textbook includes it here. I'm not sure. As you guys know, autism is a complex neurodevelopmental disorder accompanied by intellectual and social alterations. It can have verbal effects. Children can have very repetitive behaviors or very restrictive behavior patterns as well. It is four times as common in boys than girls. Affects 1 per 100 to 150 children. And of course, the cause is unknown, and there's several hypotheses, but we do not have a definitive cause. I want to emphasize that autism is a spectrum disorder, so there are children who are mildly affected, and then there are going to be children who are profoundly affected. Clinical manifestations are listed for you on your slide. While a child with autism is hospitalized, the parent needs to stay with them because it takes time for these children to accept a new person. You won't be all buddy-buddy with them as soon as you walk into the room. They may need frequent redirection of their behavior. Children with autism generally like a very structured, a very strict routine, and when you change that, that causes them to have meltdowns. Being in a hospital is a change in their routine, so just expect the meltdowns. I also want you guys to realize that autism affects the entire family. It is the entire family life is controlled by this disorder. This picture is a picture of me and my sweet little nephew, Nathan. He lives in Florida, and he has autism. He also has epilepsy. When he was born at 35 weeks gestation. He was a fraternal twin. He was small, did not grow as well as his twin brother, so when he was born, just a little on the early side. Nathan had some significant heart defects. He had a PDA and an ASD and a VSD, and so when he was about 3 months old, he underwent surgery to close his PDA. Actually, it was before then. He was just a few weeks old, and he had surgery to close his PDA. And the surgeon messed up, and instead of clamping off the PDA vessel, he clamped off his aorta, which caused compromised blood flow to everything south of his heart in his body. His kidneys took a huge hit, and he's had kidney damage and renal failure ever since as a result of that. We also think that there was some side effects that affected, that has caused his seizure disorder as a result of that as well. So Nathan's got a lot of challenges in his life. He has grown up getting blood draws every week. He has grown up going to doctors about every other week, monitoring his kidney function. A year ago, over Memorial Day weekend, Nathan got his first kidney transplant, and so he now has his blood is the cleanest it has been since he was in utero. So he now has a beautifully functioning kidney, and then I'll tell you more about his story, as this, course unfolds a little bit more. And then just a short time, within 3 months after he had his kidney transplant last fall, he was diagnosed with PTLD, which is post-transplant lymphoma, because happened to be the donor of his kidney had Epstein-Barr virus because it was a young adult, and most people get Epstein-Barr virus. However, Nathan had not had Epstein-Barr virus before. And while the kidney was a perfect match for him and it was, super compatible, it kicked off the Epstein-Barr virus when the kidney was placed in Nathan, triggered abnormal cells, and Nathan ended up with lymphoma. So this poor child who's had heart surgery, who has had renal failure, who had a renal transplant, who also has seizures and has autism, now we've thrown in childhood cancer on top of that. So he underwent chemotherapy to eradicate the lymphoma, and I am pleased to say he was just here at the beginning of the course. He was they just left and went back to Florida a couple weeks ago. And he still has his port in. He had a PET scan done right before he came to Missouri, because that's the first time he's ever been allowed to fly with all his medical issues. And even then he had to wear a mask because he's immunocompromised, and he will be forever because he takes medicine to stay immunocompromised so he doesn't reject his kidney. But he had a PET scan done and it looked good. There's one spot we're still watching. It may just be some old scar tissue, but they left the port in for now, and then we will rescan him and check him later. But I just want to emphasize that autism is very much a family disease because it has affected not only Nathan, but it has affected his twin brother. There's sometimes things that his twin brother wants to do are limited based off of what his brother Nathan can and can't tolerate and accept. And that's just the fact of life. So just think about that. When children have autism, or anytime you have a child with special needs, it's not just that one child or those parents that are affected. Siblings are absolutely affected as well. And so this is just a little practice NCLEX question for you. When you go through and you read it, what do you think the answer would be? The nurse is discussing sexuality with the parents of an adolescent girl with a moderate cognitive impairment. What should the nurse consider when dealing with this issue? Sterilization is recommended for any adolescent with cognitive impairment. Is that true or false? That would be false. That is not recommended, and it says for any, because you could have mild cognitive impairment, and those people can grow up and be fantastic parents, so that's a false. Sexual drive and interest are limited in individuals with cognitive impairment. That's a false. Sexual drive and sexual interest are not limited, and I can't remember if I told you guys that story when I was on that slide or not, but it is not limited, so that is absolutely false. Individuals with cognitive impairment need a well-defined, concrete code of sexual conduct. Ooh, I like the sound of that. Yes, that is a strong possibility. Sexual intercourse rarely occurs unless the individual with cognitive impairment is sexually abused. That just doesn't even make sense. I hope that nobody with cognitive impairment ever is sexually abused. But we also know reality and biology. Human behavior is not always driven by our brain. Hormones and other things kind of take over, and that's why people make sometimes very bad decisions. So we know that D is false as well. So it looks like C is our best choice. Individuals with cognitive impairment need a well-defined, concrete code of sexual conduct. And remember, I told you in your slides before, keep it simple. And that wraps up this PowerPoint. Hope it wasn't too boring.